joining me. This is a back workshop. That's what I'm going to call it. So a lot of us have chronic pain in our back. Some of us get acute pain. All of a sudden, you're in the middle of a workout, your back seizes up and you're like, oh my God, this is the most painful thing I've ever experienced. The next day you feel like you can't move. I have experienced this, not from a workout, but actually from a job that I had where I had to carry a lot of weight and walk around all day. Was working in a spa and I got a ton of pain right in my mid-back. I thought I had a herniated disc. That was not correct. I also do have lower back pain because I have quite a big curve in my lower back, lordosis. I'm a little bit kyphotic, upper back curve forward. Please note that there is no scientific evidence that posture creates pain. There's no support of the idea of poor posture. However, all of us develop patterns of movement that serve us, and sometimes after time, after we change our everyday movements, after we have children, after we age, after the holidays, those patterns of movement that our body uses can backfire more or less, or as time changes, our body needs new patterns. So the reason for back pain is extremely complex. I would beg to say that most of us experience back pain in a chronic way. Sometimes it flares up, sometimes it calms down, and it is highly emotional. With that said, this is a series of exercises that I've learned doing physical therapy, doing yoga, doing Pilates, experimenting on my own, and it's the kind of my go-to tricks that I use if I get a quick back pain flare-up. I will not be providing music in this session because when it comes to pain, especially chronic pain, the evidence shows that mindfulness and education can reduce that pain up to 20%. So simply listening to your body, being aware of your body, taking the time to investigate the pain and learn about it in yourself and on a macro level will actually reduce the pain. And when it comes to chronic pain, especially lower back pain, we cannot actually see it in the body. So you can't do an x-ray. If a physician were to touch your spine or touch your muscles, they wouldn't probably feel anything outside the normal tension that your massage therapist could feel. And pain should be understood more as a warning than an actual affliction. So pain, again, especially chronic pain, this is not the kind of pain that you get when you break your ankle. There's, a broken bone, a torn ligament. That pain can be tracked and traced and treated, but chronic pain can't necessarily be seen or treated in the same way. And there's no sign of it in the body. It's felt, it's perceived, and it's a warning. Our body is saying, hey, last time you did this thing, it completely freaked me out. Maybe it hurt, maybe it happened in a time when I was otherwise upset or scared and this just pushed me over the edge, so to speak. Pain is your body saying, listen, if you do this thing, I'm gonna freak out. I just wanna let you know. And so the more that we can listen as our body asks, calm our nervous system down, the less likely we are to feel that pain. And when we practice this kind of mindful call and response with our body and our mind and our spirit and our nervous system, the more likely we are to experience a pain-free life. Please note, I am not a physical therapist. I am not a physician. I'm not a nutritionist. Don't ask me about that. I am a fitness instructor. So these are just my tried and true techniques. If you have chronic pain, if you have acute pain in your back or anywhere else in your body, you should see a doctor first. And if you have any concerns that this class might create more pain for you, Don't do it. Don't do it. Rest, relax, see a doctor, see a physical therapist. You know, take care of yourself. So first thing first, we're actually gonna start in you know what, I was gonna start with breathing, but if your back hurts so bad, it like hurts to stand and hurts to sit, we're gonna start moving right away. So what you'll see here is 2 chairs set up pretty wide. I'm looking for this sort of position in the arms. And we're gonna start with a little bit of pelvic tilting. So bend your knees right now, stand up with your feet in a parallel position. Place one hand on your lower belly and then one hand on the top of your pelvis, just above your tailbone. And now here with your knees bent, I want you to exhale and tuck your tailbone underneath your body. Your shoulders stay relaxed, your neck stays relaxed. It's just a tilt forward, squeezing your glutes. And as you inhale, relax your glutes, let your tailbone push back. This is not a big movement. Exhale, tuck the tailbone under your body, like your tail is going between your legs. And then inhale, send the tailbone back. Exhale, engage your core. That's going to tilt your tailbone under. Inhale, send it back. These are pelvic tilts. That's how I'll reference them from here on out. Good. And now find your neutral. So for me, it's a pretty big curve in my low back. That's my neutral zone. Yours might look different. So come to the chairs, make sure they're secured. You can see I have a barbell here to keep my chairs in place. And set your hands on the top of the chairs. Walk back with your feet relatively wide as well, like as wide as a yoga mat, and your knees softly bent. Let your chest fall between your arms and get a big pelvic tilt, which is also like a cow shape in your spine. So we're pushing back into our heels, stretching our shoulders and finding length in the spine. Now, as you inhale, breathe all your breath into your rib cage, fill up your rib cage with your breath, and tuck your pelvis in the opposite direction. So tucking the tailbone between your legs. And then as you exhale, drop your chest toward the ground. Knees are always bent. Inhale, back of ribs toward the ceiling. Exhale, front of ribs towards the ground. Keep going like this. Notice the breath is like filling up your rib cage so much it's like a balloon going toward the sky. Keep your neck in a neutral position, relatively relaxed. And think about moving through your mid-back more than your lower back. So the buoyancy of the mid-back naturally curves the spine, and the release of the mid-back naturally curves the spine in the opposite direction. Do about 6 to 12 repetitions of this. Good. And now let's relax our hands from the chair and take a big forward fold. Knees are still soft. Hands around the elbows, rock side to side. Now note, if you do have a herniated disc in your lower back, this will hurt a lot. That's one sign that you have a herniated disc, in which you should stop doing this immediately and then call your doctor. Good. Bend your knees and slowly roll up, vertebra by vertebra. Good, and release. Awesome. Okay, so we'll move to just one of our chairs, and we're gonna do a little bit of a twisting motion here. I also have 2 yoga mats, by the way, for just extra niceness. So stand back from your chair like before, knees softly bent. Now you'll find a flat spine. So it's neither cat nor cow pose, no pelvic tilt. Bend your left knee, raise your right arm to the sky, look up to the right. And as you exhale, bend your right knee and reach your right arm through and thread the needle. Inhale, left knee bends, right arm to the sky. Exhale, thread the needle, go through. Keep going like this, bending one knee at a time, letting your hips wiggle as you reach your arm through. Once again, 6 to 12 repetitions. Good. Inhale, arm to sky. Exhale, arm through. Great. And now soften both knees, place both hands on the chair. Keeping a neutral spine, take a few breaths. Finding that reset. Okay, let's go to the other side. So, right knee will bend, left hand comes to the sky. We look up to the left. Exhale, left hand comes through as left knee bends. Continue 6 to 12 repetitions, and every time you try to reach a little bit deeper underneath the body. Always checking back in with your body, listening, remembering, educating yourself about your body. Good. And now find a neutral position again. Hold. Okay, so hands are on the chair. Once again, release, soften your knees and slowly roll up. Great. Next, we're gonna come to, for me, a door jam. So ideally, this is actually done on, if you can think about at the gym, a squat rack or some large, if you have like a railing at your house, and you can put your hands on the railing as the stairs, you know, on the next flight, something like that. But we're looking for a big X-shaped position. So ideally, I'm showing you now from the front, your feet are wide and your toes are propped on this surface. Your arms are wide and you're able to pull your body back in a triangle shape. So I'm gonna do it actually on my door jam here. And I'm gonna take a couple of weights, even just one is probably fine, and put it on the door jam so that I don't pull the door toward my body. My feet will help resist, that's correct, but just want to be safe. So ideally, you're not moving big weights right now when your back hurts, but you can always ask someone to move things around for you. That's fine as well. So I'm gonna wrap my hands around the top of the door jam as far as it will go. I'm gonna bring my feet up and then pull my glutes back in space like a hanging motion. Here I'm gonna do my pelvic tilts again. So as I exhale this time, tailbone tucks, inhale, send it out. Exhale, tuck, inhale, out. So now it's just really our lower back moving and our pelvis, and we're creating length. Six to 12 repetitions. And release. Awesome. So relax there. That's good. I think we are done with our standing poses. Hopefully by now you've found a little bit of release in the spine. Maybe you have a little bit more movement available to you. I'm going to grab a foam roller as a prop. You could sit on anything though here, and we're going to sit down on the ground. So this something underneath your glutes will help your lower back to find some space. If possible, bring one foot in front of the other, knees out to the side, and find a neutral spine, whatever that looks like for you from earlier. We're gonna focus on breathing right now, because when I had that mid-back pain, it was actually related to the fact that I wasn't breathing deeply, and my diaphragm was constantly pulling on the connection point between my mid-back and my rib cage. And that created tension for long enough that I had pain. So let's breathe for just a moment. You're welcome to close or open your eyes, doesn't matter. Hands can go wherever, just what feels right for you. And I want you to inhale for a count of 3 breaths. And exhale for 3. Through your nose. Out your mouth. Inhale, nose. Exhale, mouth. Continue to breathe like this. Relax your belly muscles. Relax your back muscles. On the inhale, feel your belly expand, full of breath. On the exhale, feel the belly contract. On the inhale, feel your lower back fill up with breath. And on the exhale, feel your rib cage fall towards your spine. Breathe more slowly. Inhale for a count of 4. Exhale for a count of 4. Take several more deep breaths, expanding your relaxed core with your breath. Great. Allow your eyes to open and remember that if you are in so much back pain, you feel like you can't even move, just breathing in any position will probably help. So with that said, we're gonna do some stretching on the ground here. So I'm gonna stay on my foam roller. However you want to get to this position is fine. I'm going to bring it behind underneath my tailbone and then bring my elbows down and then bring my knees to my chest and hold this position. Knees toward the chest, getting a huge stretch in the lower back with the assist of something underneath your tailbone. Just breathe. You're welcome to bring your arms over your head if that feels good, or any other position. Stay there. Okay, so if you're in this position and your back is feeling good, then you can raise your feet all the way up to the sky if you'd like, and maybe further towards your face. We don't push it here. I think a good thing to remember in this whole session is that you're not trying to solve the problem. You're just trying to explore it. And that means that you don't push yourself into different positions. It's just a constant awareness and a love and a breathing into, giving your pain a big hug. That's how to think about this. Okay, so wherever you are, bring your feet back towards your glutes. Set one foot on the ground and then the other foot on the ground, engaging your core as you go. Squeeze your glutes and lift your hips up just off of the foam roller. You can move it to the side or whatever that is. Could even just be a pillow. And we're holding here for a moment in our bridge. Tucking the pelvis under, so the tailbone between the legs. Feeling how flat that makes your lower back. We're not pushing our hips as high as they can go. We're just engaging the glutes and lengthening the spine while releasing the front of our hips. A couple more breaths here. Good. And now slowly roll vertebra by vertebra down. Good. Bring the right leg and then the left knee back to the chest. Here we're gonna hold the knees really tight, so keeping them as close to the chest as possible. Right arm wraps around the legs, left arm goes out to the side. Keeping the knees as close to the chest as possible, pull them to the right and look towards your left for a very deep twist. We take about 5 breaths when we're doing our stretching poses. So 5 inhales and exhales. And come back to the center, switch, wrap the hands around the legs once again, and pull in the opposite direction. So left arm around legs, legs go to the left. Keeping the knees together, keeping the knees close to the chest. Big breaths. It can always help to count that 3 count inhale, 3 count exhale. And now come back to the center. Beautiful. Keeping the knees together but loose. Draw small circles with your knees. And switch directions. Good. And now letting the knees separate, but keeping the toes together like child's pose. Draw circles with your knees. They're 2 different circles. So together, then apart, together, then apart. And then switch directions. Great. Okay. Bring the knees to your chest. Tuck your chin. You don't have to roll up. This can be really painful, but if you can, just roll yourself up, keeping your hands on your legs. Okay, so we'll bring our feet around and we'll take a child's pose. That's toes together, knees apart, hips towards your heels, hands forward. Relax. If this hurts your back, you can also bring your knees to touch each other, and that can give more back support. Now gently come on up. If your knees are together, separate them again into child's pose. Now, this is a lot like the move we did earlier with our hands on the chair. Our neck stays neutral and our lower back stays neutral and relaxed. Our focus is on the middle back, but that will stretch our lower back. So elbows to your legs, hands in a relaxed prayer. Gaze slightly in front of your fingers. Keeping your tailbone close to your heels. As you inhale, fill up your rib cage, push it back. And as you exhale, drop your rib cage between your arms. Inhale, fill up the rib cage, push it back. Exhale, drop the rib cage between your arms. Inhale like a balloon. Exhale, drop. 6 to 12 times. Notice how the lower back floats in response to the mid back. and come on up. Great. Okay, so we're coming into a kneeling position. Knee underneath hip. Send the left foot forward and hold here. Engage your right glute. Hi, Cleo. Wrap your right arm around your left knee. Pushing the right hand into the knee. Open the left arm to the back for a very simple twist. Engaging the right glute is very important. And now come through center and we switch. Left knee down to the ground, right foot forward. Engage the left glute. The sensation is tucking it under. Left arm around the right knee, pressing them into each other. Right arm opens to the back. And come to the front. So you might skip the next position if your knee and your ankle and your hip don't have the mobility. You can also grab a foam roller and set it underneath your hips. We're going into pigeon pose that you probably know from yoga. So I'll take my right knee to the right side of my mat, my right foot toward the left side of my mat and in the center. Lift my chest up and first start by rocking side to side. The foam roller would go underneath your glutes here if you're using it. Stay up if that feels like what you need, or lower down. Your head could rest on a pillow, on your hands, on a foam roller, or on the ground. The most important thing to do here is try to let those hip muscles soften. And in this entire class, it's important to notice which emotions come up when you feel sensations like fear, when your heart rate elevates, if your brain starts to try to think about other things. Yeah. And now come on up. We'll take a downward dog pose here. So engage your core, step back, drop your heels toward the ground, and breathe with your head between your arms. Keeping the belly engaged here will help. And now come forward, left knee to the left wrist, right leg slides back, and lift up. Maybe rocking from side to side. You can once again take any variation you'd like, especially when it comes to situations like pain. You don't have to do the same thing on both sides of the body. And gently come on up. Good. So you could do a downward dog again here, or any other pose that's calling to you. We're going to go into the last part of this class. You will need something like a yoga strap or a TheraBand or a belt for this section. So however you'd like to come up, just do it slowly and mindfully. I'm going to grab my yoga strap. Can't remember where it is. The more secure this item is, the less give. Here we go. I have 5 million yoga straps. A lot. Alright, so I've got a simple yoga strap. There's not much give to it, and that's what we're looking for. I would even say that a leather belt would be better than a TheraBand, but just make sure it's nice and long. So many of you who've done my yoga before have done this series. It's a great way to release the muscles around your hips, which in turn can help with your lower back. You will need plenty of space here to both sides of your body, so find that space. And now gently come to your back. It's important to press your lower back toward the ground and to keep it there for the entire time. Take the strap and wrap it around your right ball of your foot, pulling your toes towards your face. So the strap is around the right ball of the foot, the toes are towards the face, and the lower back is pressed into the ground. For this entire series, we're working on bringing both our toes towards our head, as well as straightening the knee. It's more important to straighten the knee than it is to pull the leg close to your face. So if your leg is way far away from your torso, that's okay if your knee is straight. We are looking for the release, the straight knee back behind. If it hurts your knee to extend it, then yeah, bend it, who cares? But that's what we're looking for. Now we've been holding it to the center. We're gonna take our left and our right hand and work together to bring the right foot out to the right. It's very important that your left knee stays bent and left foot stays on the ground. Left hip stays on the ground. We don't want the lower back to lift. So I have my left hand on my left hip, and I'm gonna stop as soon as I feel like my lower back is starting to lift off the ground to my left side. Once I find that dimension, I'll work on bringing the toes toward my face. Maybe I can relax my right elbow to the ground and just find a little release here. And now I like to take my left hand to pull the foot up. You're welcome to hold all of these poses as long as you'd like, by the way. Now we're going to keep this foot so that the foot is flat toward the ceiling. Use our left hand to navigate it over the left side. Again, right hip stays on the ground, lower back stays on the ground, so just stop when you found your dimension and relax. And now right foot to the sky. This is the best part, in my opinion. So you want the razor edge of your foot toward the ceiling, which is basically the little toe side. So you'll take your left hand, pull your foot so the bottom of your foot faces the wall. The little toe is up and you feel like it's a very thin edge. Right away, you'll get some release in your right ankle. From here, right hip stays on the ground. Start to pull your leg to the left, but stop as soon as you need. So you'll hopefully get a big stretch all the way up the outside of the right leg. You probably won't get very far. That is fine. And then again, we're working on bringing the toes toward the face. Keep that knee straight. I know it's easy to start to lose the straight here. Good. And then bring the leg back to the center and release. Beautiful. From here, bring your right knee to your chest, send the left leg long, and then bring the right knee all the way across your body for a twist. Hopefully you just got a couple pops out of your back like I just did. And now come to the center. Beautiful. Bring the left knee in, set the right foot down on the ground. You might even set both feet down, kind of lift and reset your hips so you're all straightened out, and then we bring the left leg up. Wrap the band around the ball of the left foot. Pull the foot towards the body and just breathe. So this is a fine balance between relaxing the muscles that you can and keeping some muscles tense in order to achieve the purpose. So here we would have our quadricep tense so that the back of our body can stretch. Okay, so right hand goes to the hip. You can also use it to help the strap navigate. Left foot out to the left side. It's really, you've got to be so thoughtful here because we want the right side of our body to stay on the ground. You might be able to get less far than you think. It's not necessarily about the flexibility of your leg. It's more about the alignment of your hips. Okay, navigate that leg back to the center, keeping the shape of the foot. Left hand goes to the left hip, and we pull the leg across our body to the right. You'll feel a stretch on the outside of the left ankle. Yeah, that's correct, but this is still a little bit more toward the back of the leg. And now bring the leg back into the center. Take the right hand, pull the right big toe towards your face. Left foot, left little toe toward the sky, so the inside of the foot faces the side. Left hand into the left hip. And now keeping the razor edge foot of your razor edge of your foot toward the sky, pull the foot over to the right. Ooh. It's intense, and then towards your face if you can. Knee is straight. And gently release, bring your leg back up, release the strap, bring your knee into your chest, squeeze it tight, send the right leg long, pull the left foot across the body over the right side. And come through the bring both knees to your chest, rock it side to side, big hip rocks. Roll over, set your feet down, roll onto one side, and gently push yourself up. Good. So your back might be very sore right now. It might not have been easy for you to get up. That is okay. Take your time doing it. Feel free to sit here and just breathe, or lay here and just breathe. Call to someone in your house to come pick you up. Cuddle with your cat on the ground. Once you're ready to get up, I would suggest drinking not just a water, but an electrolyte beverage. Because you have just released a bunch of toxins into your system, so you want to be able to hydrate as quickly and effectively as possible. If this was very anxiety-inducing, give your doctor a call, and if it helped, let me know in the comments below. Let me know which of the poses helped, and I can go deeper into any of the things that we did today. So, thank you so much for joining me. I hope that you feel better, and I look forward to seeing you in a workout when you do.